So I grew up on a family farm, much as you can see we like living out in the country. And I actually wanted to go to vet school. I always had a love of horses and wanted to be a large animal vet. And at that time, you still looked up job opportunities in the newspaper. Went and interviewed for some pharmaceutical sales jobs. And then on top of that, I also saw that they were interviewing for opportunities for independent health and life insurance agents. And my grandfather, when I was a young child, worked through Farm Bureau some and did some life insurance. And I remember the way that he made people feel. Being a woman, I wanted to make a difference and do something that felt more inspiring, but to really change people's lives. 2004, opened my own firm just to be able to serve folks on a much broader lens. So they weren't so confined to a couple different plans or products. We could be more of a concierge type of service for the customers that we serve. Fast forwarded, now we have an amazing team. Nolan's part of the team, and really focus on how we're making people feel and building trust through those relationships. And Nolan kind of onboarded with us about 7 or 8 years ago, and our team is just amazing. So now it's all about the team and how we can develop clients from that nature.
So my story's a little different. I was raised blue collar. My path was you get a job, you get a pension possibly, and just work hard and do what you're supposed to do. I went and graduated and got my doctorate, and then started in the private practice world of physical therapy, and felt that was what I was supposed to do. I had kind of reached where I thought was kind of the top of my profession. I was a director, and so I was like, life is good. But the problem was I was missing a lot of things with the kids. And so that started changing my thought process on, what do I need to be doing differently so I can spend more time with the family. I joined the company back in 2018 and have had some really good success. Mindy and I working together and really creating a really great plan for all of our clients. Mindy and I's heart is, we have a serve mentality, and we just want to keep serving not only our faith, we want to serve that first, but we want to serve our clients, and then we also want to serve our community.
Keep setting a stage for our young daughters and the young folk that are even part of our team in the office, and inspire and keep growing them and just keep helping more people.
In hockey, obstacles are everywhere. In life, it's no different.
Understanding healthcare, smart investing, and tax planning.
At McIntosh and Associates, your goal is our game.
To hit your goals, you need the right strategy and the right team in your corner.
Smart investing, tax strategies, and retirement planning require vision and teamwork.
Because your future is worth the investment.
All right. Fun fact about that hockey video, I did that 3 times, and they used the first take. So I don't know if they did that on purpose or not, but it was also my idea, so don't think that somebody forced me to fall on the ice like that, but it was their idea to do it 3 times, even though the first one was fine. It's fine, whatever. So my name is Nick Kane. I am on the healthcare team at McIntosh and Associates. Little housekeeping before we get in. On the way in, Kara and Olivia. Kara's in the yellow jacket. Olivia has the microphone. They got you checked in. Kara is on our planning, support, implementation team. She does so many things, I never know what her title is. It really just depends on what's on the schedule that day is what she actually does. And then Olivia, if you call our office or if you come in for a visit, she is going to greet you with that same smile that she has on now, even though it's 6:30 and she's worked all day. And she is going to get you a snack or a cup of coffee or a Diet Pepsi. We're still working on getting Diet Coke in the office, but I don't think that's going to happen. But Olivia is going to get you greeted and sat and ready for a great visit. So again, I'm on the healthcare team. You have in front of you a firm brochure, gives us a little bit more information for you about what we do and how we can help you live the most outstanding retirement possible. In there is a event evaluation form. This is more for you to grade how you feel at the end of this little presentation that we're going to have tonight, this conversation. There's different sections on here that follow our focus process. So our mission, outlined in here, is to help good people make great decisions to live the most outstanding retirement possible. We're going to talk about how that works, combining healthcare and financial wealth care into a package to get you going. We learned a little bit more about Mindy and Nolan in the video. Much like Nolan, I grew up in a blue-collar family. I worked in a construction company from the age of 10 when I was sitting in a job trailer, freezing cold, putting nuts and bolts together. It was 2 washers and then a nut. That was what I had to do. That was the only thing I ever remembered. It was kind of like Legos. How many grandkids have Legos? Everybody, can you believe what Legos have become? I mean, I just remember I can build a little car. It's got little wheels on it. Now we're building like Hogwarts and flowers and all kinds of stuff. The most important part about that, though, was the instructions. I remember one year I got a pirate ship for Christmas. That's all I only wanted that pirate ship. It was huge. At the time, I thought it was big. Now I look at it, it's only about this big. I was so excited to open it up and put it together. Got all the bags out, and I'm looking at it, this is great. And then at the time, we were putting all of the wrapping paper into the bonfire. You now already know what happened, right? The instructions on how to put the pirate ship together went in the bonfire with all the wrapping paper. It took way longer than it was supposed to figure out how to put that pirate ship together. But once I got it together, I never took it apart because I was afraid I was never going to do it again. The good news is we have a blueprint to help you with your retirement, so we're not going to throw these instructions away. This is the foundation of what we do and what our focus process is. You see it everywhere on here. And the evaluation form that you have is going to evaluate where you stand for yourself on this focus process. What does it mean? Future income planning. When you're working, it's easy to know where that income's coming from. How many people are still working? Quite a few. This is going to be interactive, so if you haven't limbered up, you might want to stretch. So if you're still working, we know where the income's coming from, but what does that look like when you retire? You still need a paycheck in retirement, right? That might mean optimizing investments, getting the most that you can out of Social Security, combining it with some of the other accounts and funds that you have. Comprehensive tax strategies is the C. We're not going to do your taxes, but we are going to make sure you don't have to pay a penny more than you need to, unless you want to pay more in taxes. Who wants to pay more in taxes? No one ever raises their hand when I ask that. One guy did, and he was like, I'd like to give to charity. I'm like, that's a different kind of tax. You're doing something different. My focus is the understanding healthcare. That pillar is very important, because usually when you're working, you have coverage through your employer, and you don't really have a lot of choices in that, right? You just sign up for whatever they tell you that they have. What happens when you retire, whether you're 65 or not? You have a lot of options, and we're going to go over some of those today. And that leads to strategic legacy planning. That could be leaving money to your favorite person or place, or one of the many hats that Kara wears, setting up a will or a trust to make sure that everything that you've worked so hard to get goes to the right people in the right way. And it could just mean making sure your last check bounces on the way out the door, right? Wouldn't that be the right plan? You've saved up all that money, spend the last dime, and then be done. So that is our blueprint. We're not going to throw these instructions away, and we're going to review them as we go through things. So first off, we're going to talk about healthcare. I asked, quite a few of you are still working. How many people are 65? There's no shame in raising your hand if you're the only one. 65 or older, I guess, is fine. I don't like to use the O word. I like to say you're more experienced. So if you're past 65, you're just more experienced. So we're going to talk about what the health insurance market looks like and your options. There's going to be some common terms that we're going to go over today. One is original Medicare. One is Medigap. You may also know it as Medicare Supplement, but tonight we're calling it Medigap because we don't need 2 names for the same thing, right? It's already confusing enough. Another option is prescription drug coverage, and then Medicare Advantage. So if you are not yet 65, you might have coverage through your employer. If you're not working and you're not 65, you might have coverage through the health insurance marketplace or the Affordable Care Act or Obamacare or whatever you want to call it. You might have it on your own. If you are still working and you're 65 or more, you can probably still keep your employer insurance. That's always one option, as long as your employer is qualified. What does that mean? They have to have at least 20 employees. So if it's a family farm and you have 2 employees and it's you and your wife and you get insurance and it's paid for by the company, that doesn't count. But if you work for like one of those big companies in town that has the red diamond with 3 letters in the middle of it, you can probably still work if you're past 65, right? Because you're covered by your employer. So we're going to talk about what happens if you're 65 and not covered by your employer. That is original Medicare. Who here has Medicare? Medicare. Medicare. Okay. Some of this might be review for you, some of it might be new information. So the first part is original Medicare. There's two main parts to Medicare. Part A and Part B. If I go too fast at any point, throw the pen at me and I'll slow down. Don't really throw the pen at me. Part A helps cover your hospital stays, okay? Inpatient hospital care. Think of the bed, the building, and the breakfast. As long as you've worked at least 10 years in your lifetime, Part A doesn't cost anything. You're entitled to Part A. Now, if you don't have enough working credits, there can be some cost involved with Part A. Most people don't have to pay for it. If you're still working and you're 65 or older, you can enroll in just Part A, and it will pay secondary to whatever your employer coverage is. Fair? Okay. Part B, Medicare, is the most close thing that you can get to normal health insurance. That's your medical insurance. Doctor visits, outpatient surgeries, immunizations, wellness visits, durable medical equipment. That's Part B. Part B has a standard monthly tax or deduction or premium, whatever you want to call it. When you sign up for Medicare Part B, you have to pay for it. The standard deduction changes every year. And this is where we're going to get into some fun math. So the standard deduction is based on what you made 2 years ago. Right. We're going to come back to this. I know, that's the face I made when I first learned about it. So it's based on your income from 2 years ago. So if you're 65, it's based on what you made when you were 63. And then that moves forward every year. So when you're 66, what's 64? Okay. Depending on what your income was, Part B could cost more. The standard deduction for this year is $202.90 per month. And again, that changes every year. So next year when we have this conversation, don't tell me, you said it was $202.90. I know, that was last year. Who thinks that price stays the same every year? No. Who thinks it goes down? Who thinks it goes up? Yes. It's only gone down in my experience one time. And then the next year it went right back up. So I don't know what determines the cost of it. It's just important to know. Yes.
I just learned that you can opt out of that.
You can opt out of Part B? Depending on the situation, yes.
You don't have to take it and pay for it. You can opt out of it.
As long as you have employer coverage?
No, you just go without it.
Okay, so I don't know about that. So she's saying that you can opt out of Part B and not have any other insurance coverage. I'm going to say yes and no. So there is some timing that's important for Medicare Part A and Part B. We'll get into that when we get to the enrollment periods, because when you just turn 65, you have what's called an initial enrollment period. It's the 3 months before you turn 65, the month you turn 65, and 3 months after. We're kind of skipping ahead. If you don't sign up for Part B in that window, and you don't have employer-sponsored coverage, you'll get a late enrollment penalty for not signing up for Part B. So you have to have Part B when you turn 65. You have to.
You can opt out of it and take the penalty if you decide to take it later on.
You can also drive 100 miles an hour down the road, but I don't recommend it.
Well, you might not recommend it, but you can
You could,
still opt
okay.
out of it.
Sure, you can opt out of Part B, but technically you're not supposed to. That's a unique situation that I don't recommend.
If you can't live on what you're making.
So with Medicare, Part A and B, there are a couple assistance programs. Okay, one is the low income subsidy, that if you do have a low income, you can apply through the state for low income subsidy, and in that case you still have Medicare, but the low income subsidy picks up your Part B premium. So that way you still have it, you don't get the late enrollment penalty. There's also something known as extra help, that depending on your income, you may not qualify for the low income subsidy, but you can get what's called extra help to assist with the cost of your medications. So that's a little bit more advanced baseball. We'll get into that further into the thing. Any questions on A and B so far? Okay. With original Medicare, that's A and B, Medicare covers 80% of your medical cost. You're responsible for 20% of the medical cost after your deductibles have been met. Part A has a deductible for hospital stays, and Part B has a deductible for medical cost. Part A this year is right around $1,700-ish. Part B is $283. Once those deductibles are met, you're responsible for 20%. That 20% is just a little wedge of this picture, but it's also uncapped. So if you have $1 million in medical bills, you're on the hook for 20% of that, which oftentimes is too much money, right? That's an unknown number. So how do we fix that? There's a couple different ways you can do that. One is a Medigap plan. So you still have original Medicare, and your doctor still sends the bills to Medicare, but this Medigap plan fills in that 20% gap, okay? This is very similar to homeowners insurance because you pay a monthly premium for that Medigap plan, whether you use it or not. But if you do go to the doctor, that Medigap is going to fill in the space that you were responsible for, okay? There are several different letters associated with Medigap. There's A, K, N, G, F. All of them are exactly the same. Let's just say, for example, we talk about Plan G. G does not stand for anything other than that plan, right? It's not short for anything. Plan G, you're responsible for your Part B deductible, and then it covers 100% of your medical cost after that. Every Plan G is exactly the same. The only thing that changes from plan to plan is what they charge you. That's it. So with a Medigap plan, you also have to have prescription drug coverage. Even if you keep just original Medicare and you say, I'm okay with that 20% of an unknown dollar amount, you still have to have prescription drug coverage, even if you don't take prescription drugs. So Part D, that's the only thing the government made easy here, D is for drugs. Part D is mandated by the government that you have it, but it's not provided by the government. You have to get it from a third party. This prescription drug coverage, even if you don't take medications, is required. Otherwise, you start accruing a late enrollment penalty, which you don't have to pay until you sign up for prescription drugs. It starts accruing from the date you're eligible for prescription drug coverage, but it just hides in the background. And then someday you'll sign up for prescription drug coverage, and then they hit you all at once with it, and that penalty stays with you forever. It's not like a parking ticket that you just pay and then it goes away. It stays forever. The longest late enrollment penalty that I've ever seen is 300 months. And the penalty is 1% per month that you should have had the coverage, and it's based on what the average cost of a drug plan is for that year. So not only do you get the penalty changes every year because the average cost of a drug plan changes every year. So we try to work on timing so that you don't have those late enrollment penalties. So that's one option, Medigap, Part D. The other option is a Medicare Advantage plan, also known as Part C. The C could stand for combo or complete. Because with a Medicare Advantage plan, you still have to have original Medicare. You still have to have A and B. But this Medicare Advantage plan, instead of the doctor sending the bill to Medicare, they send the bill to the Medicare Advantage plan company. And then they have pre-negotiated rates for services. You pay a copay. It's pay as you go, right? You don't go to the doctor, you don't have to pay the doctor. If you don't have an outpatient surgery, you don't have to pay for it. But if you do, you'll have a copay involved with it. A lot of times they don't have a deductible. Sometimes they do. If I say deductible, does everybody know what that means? Okay. It's okay if you say, I'm going to tell you what it means anyway, just to make sure everybody knows. So the deductible is the amount that you have to pay of the full cost of that service until the deductible's met. And then the copay kicks in. Most Medicare Advantage plans don't have them, some of them do. But Medicare Advantage plans also have extras like hearing, vision, and dental. Medigap plans do not have those. So if you want to add that coverage on, it's another plan with another company and then another premium and sometimes other deductibles and other costs. But with a Medicare Advantage plan, it's all built into one. The three options side by side, the most important part is you still have to have A and B. That's a question that we get a lot. They say, well, I have a Medicare Advantage plan. I don't have to have Part A and Part B. No, you still do. That's the price of admission. You got to get into the Medicare theme park. That's the Part B premium. Then whether you go on a Medigap ride or a Medicare Advantage ride, that's just the ride you choose to go on when you get there. I use a lot of metaphors. My wife hates it when I use metaphors. Analogies, metaphors. I don't even know what the difference is. Different side by side. I'm not going to go through the whole slide, but there are pros and cons to everything. A lot of times you'll hear in the news, who's here has heard a news story negative about a Medicare Advantage plan? Nobody? Who here watches the news? Okay. Just want to make sure we're just all not skipping the news, which is fine. I mean, you're more than welcome to skip the news. So there's a lot of stories that you'll hear that are negative about a Medicare Advantage plan. Oh my gosh, prior authorizations are the worst. I have to stick to my network. Oh no, this doom and gloom. We all know that, what's the phrase, if it bleeds, it leads. If it's a negative story, that gets a little bit more traction than a positive story. So sometimes you'll hear negative stories about that. There are pros and cons to everything. That's why we look at your individual situation. Because what's right for me might not be right for Kara. Probably isn't right for Kara if it's right for me. So that's why we look at every situation. Sometimes it does make sense to have a Medicare supplement. Sometimes it makes sense to have a Medicare Advantage plan. Sometimes you just want to have regular Medicare, and that's okay. We work on that together, look at your entire picture, medications, doctors, where you want to be able to have care, so that it's customized exactly to your needs. Just as an example, in Midland County, is everybody here from Midland County? No. Saginaw. Okay? Bay. Gratiot. I don't know what other county. Clare? Okay, doesn't matter. In Midland County, there are 27 different Medicare Advantage plans. How do you know which one's right for you? By doing an assessment with us and we review all your needs. Unless you want to learn about all 27, because who here brought their Medicare and U-book? Somebody's got it? You got it. How much fun is that to read, right? If you can't sleep, that's a good thing to start flipping through because it'll put you right out because there's so much confusing information in there and it only tells you about half the story. One of the missing pieces, regardless of which option you go with, Medicare Advantage or a Medigap, is short-term and long-term care, whether that's at home or in a facility. There are limited benefits with both Medicare and a Medicare Advantage plan for home care and skilled nursing. It's very limited coverage, and there are certain requirements and hoops that you have to jump through to qualify for it and to keep it. So that is a concern that oftentimes we hear, well, it's okay, Medicare will take care of it. Maybe. Or my Medicare Advantage plan will take care of it. Kinda. So that is, if that's a concern, there's options to fill in that gap as well. That's a gap that stays open whether you have an Advantage plan or a Medigap plan. So enrollment. We're going to talk about enrollment so we don't have late enrollment penalties. Mentioned it earlier, the first time you can enroll in Medicare, for most people, 3 months before you turn 65, the month you turn 65, and 3 months after. As long as you enroll in Medicare A and B in this window, you don't get late enrollment penalties. You also have to add on prescription drug coverage of some kind, whether it's on its own or with a Medicare Advantage plan that's built in. That's your initial window. The annual enrollment period is a time to learn what 80s celebrities need to pay alimony or buy a new house because they start talking about all the different options that are available. That runs October 15th to December 7th every year. During that time, you can make as many changes as you want. You can go from a Medigap plan to a Medicare Advantage plan. You can go from a Medicare Advantage plan to a different Medicare Advantage plan. You can go back to original Medicare and just add on a drug plan. You can do as many things as you want. Whatever the last thing you do on December 7th is what will go into effect on January 1st. But what happens if I'm still working? What if I'm past 65 and I'm still working and I've decided I don't want to work anymore? We're going to skip this slide and go to this one because I've set this slide up. So, if you're still working and you're past 65, you qualify for what's known as a special enrollment period. A special enrollment period means you can sign up for Medicare whenever you want. The most common special enrollment period that we run into is that exact situation. You're still working, you're still covered by your employer, and you're past 65. Then you can sign up for Medicare at any time, drop your employer coverage, even if you want to keep working. You can drop your employer coverage and sign up for Medicare. Because sometimes Medicare costs less than what your employer coverage costs. So then it makes sense to keep working and just drop the insurance, right? Then you can go to Medicare. You have that option. Or another common special enrollment period that we have is you move. If you move to a different zip code and the plan that you currently have is not available there, you get to move to a different plan. You can't control when you move, right? You can't help that that plan's not available there, so you get to move. Even if you move across the street and it's a different zip code, which could happen, right? There's parts of this world that across the street's a different county, a different zip code. You can still enroll in a different plan. Coming back to this one, there is another window. We're currently in it for the next 5 days, 7 days, 5 days. I'm not good at math. That's why I'm on the healthcare team. 5 days. We are in the open enrollment period. This is only available if you have a Medicare Advantage plan. That open enrollment period is a one-time get-out-of-jail-free card. Let's say during the annual enrollment period, you changed. Or, which happens a lot now, who's got a scam phone call or text? Everybody, right? I got one while I was waiting for this thing to start upstairs. If for some reason, some slick-talking guy signed you up for something that you didn't intend to sign up for, you have a chance to get out of that during this open enrollment period if you have a Medicare Advantage plan. You can only make one change. It runs between January 1st and March 31st. Oh, I'm going the wrong way. All right. So, again, cannot stress this enough. No matter what Medicare option you go with, you have to have A and B. If you have an Advantage plan, you have to keep A and B. If you have a Medigap plan, you have to have A and B. You have to. So earlier, I talked about how your Medicare Part B cost is based on what you earned 2 years ago. Let me introduce you to my friend IRMA. IRMA stands for Income-Related Monthly Adjustment Amount. There's a lot of numbers on here. Don't let it scare you. Because you get a cost of living adjustment with Social Security, right? So this shouldn't be that big of a deal, except this usually wipes out the cost of living adjustment that you get. So the income-related monthly adjustment amount is based on what you made 2 years ago. For this year, a couple married filing jointly, as long as 2 years ago you didn't make over $218,000, the standard Part B premium is $202.90. If you made $218,000 you have to pay more for your Medicare Part B. It goes up to, I think, $750,000 and above is the maximum 2 years ago. The most that you'll usually have to pay is like $780-ish for Part B. But it gets reassessed every 2 years. So it's just based on what you made 2 years ago. So if for some reason, let's say you have a pretty good paying job, and 2 years ago you were still working, and now you're signing up for Medicare Part B, but you're retired now. The income might not be that high. You can request an adjustment to not have to pay that, but a lot of times you have to. That's why it gets reassessed every year. The other thing to take into consideration, and this is where the healthcare team and the financial team come into play. Depending on how your money is invested and the amount of money that you have invested, you could be forced into an IRMA when you have to start taking money out. Because if you have an IRA or other tax-qualified investment account, when you get to that certain age, maybe 72, 73, and you have to take what's called a required minimum distribution, you have to take that money out, and if you don't, you get penalized. So when you take that money out, it could kick you into an IRMA. So that's where on the health side, we work with the financial team to make sure that we can help you, if not avoid the IRMA, because sometimes you can't avoid it, at least make you aware of it well in advance so you can plan for it. Because if you suddenly come upon your Social Security statement that says your Medicare costs $500 this year and last year it was $200, that can be a shock, but there's ways that you can prepare for it in advance. IRMA impact, this is me, by the way. When I have my glasses on, this is a self-portrait. So we want to make sure we're planning ahead so that we can minimize your IRMA impact or avoid it if possible, okay? Before we jump into the wonderful world of Social Security, I will open the floor and Olivia is going to come around with questions for the Medicare side of things. Any questions? So I either, yes, right up here.
I don't think I need a mic.
It's for the video.
I'm older than my husband,
Okay.
and I'm 65 in November. I'm still on his insurance.
Mm-hmm.
I know I have to get this, but do I have to get the drug?
So if you're great question. You're a little bit more experienced than your husband is, and you're still on his insurance because he's still working.
Right.
Keep him at it as long as you want.
I'm gonna try.
So if you're still covered by either your employer-sponsored insurance or your spouse's employer-sponsored insurance, you don't have to sign up for Medicare at all. You can wait. You don't have to do anything. And there's no penalty because you're covered by qualified employer coverage. I'm assuming your husband works for a company that has more than 20 employees? Okay. So what happens then is if you're going to delay enrolling in Medicare, it's one extra form that you have to have the company's HR department fill out that shows how long you've been employed, how long you've had the coverage, and when the coverage ended. That's it. And then you avoid the late enrollment penalty. So you keep him working as long as you want. You never have to sign up for Medicare.
Would it make sense to take it and then knock his insurance down to just 1%?
So that's where we look at what the total cost of things are, right? So we have to look at what it costs to have you on his insurance and how that compares to what it would cost for you to go on to Medicare and drop him down to an individual person. Like, for instance, some companies will fully cover the employee's health insurance. But to add a spouse on cost, let's just say a number, $400 a month, right? That's more than what it would cost for that spouse to go on to Medicare. So in that situation, we'd say, drop your spouse off the employer coverage, sign up for Medicare, you're going to save a couple $100 a month, and then we just look at it that way. It depends on the situation. If it isn't a major cost difference, and depending on what time of the year it is, you may have met deductibles, you may have met some max out-of-pockets with the employer coverage. It doesn't usually make sense to switch because then all that stuff starts over again. So we look at the situation individually and determine what's best. It's case by case. Yeah.
It said that you had to have the drug part of D or something?
Yeah.
Is that also with the Medicare Advantage plan?
Good question. So the prescription drug coverage is typically built into the Medicare Advantage plan, so that counts. So you don't have to have a standalone. In fact, you can't have a standalone prescription drug plan with Medicare Advantage. You have to have it built into the Medicare Advantage plan.
And if you went the Medicare route with the drug portion, is there an additional cost for the drug portion on top of $202?
Sometimes. There are multiple different prescription drug plans that are available. So sometimes there is a premium for the prescription drug plan, but oftentimes there's a $0 premium and then you just have co-pays and deductibles they have to deal with. It depends on what your drug needs are, if it makes sense to have a plan that has a deductible or not. But again, we kind of evaluate the whole situation. Sometimes if you're on just maintenance medications, you can oftentimes enroll in a prescription drug plan that doesn't have a monthly premium. And then usually the co-pays are pretty low for the maintenance medications. But when you get into the GLP-1, Ozempics and Mounjaros and Wegovy's and all those, then sometimes you can still get a plan that doesn't have a premium, but just depends on what the drugs cost at that point. Yeah, this is a good question. All right.
Is there a monthly premium on Medicare Advantage plan?
Sometimes. How do you like that answer? Sometimes there is a premium for the Medicare Advantage plans. A lot of times there isn't. Just depends on how the plan is structured and kind of what benefits are most important to you. A lot of times you'll see a $0 Medicare Advantage plan. But if you want to upgrade the dental coverage, that might add a premium onto it. So it might start at $0, but then maybe adds like a $30 or $40 a month premium to get better dental. There are some Medicare Advantage plans that do have like $130 or $200 a month premium. There are cases that those make sense. A lot of times they don't, but
Is that on top of the 200?
yes, no matter what option you go with, you have to keep paying for Part B. You have to have it. That's like I say, the price of admission to the Medicare park. You got to pay it no matter what. Even if you just stick with original Medicare and add on a prescription drug plan, you still have to pay for Part B. Unless you qualify for low income subsidy or extra help or things like that. Yeah. All right. Going once, going twice. Oh, yes.
On the Medigap,
Yeah.
you said that there's different letters,
Yes.
but it's all the same plan?
Well, the letters are different. So like a Plan G is a Plan G no matter what company you get it from.
Okay.
A Plan N is a Plan N no matter what company you get it from, but an N and a G are different.
Okay, so if the premiums were different, like within the Gs, why wouldn't you just go with the lesser premium?
That's a great question. Why wouldn't you just go with a lesser premium? So with Medicare, or Medigap, I almost said Medicare supplement, Medigap. What we look at with those is most Medigap plans increase their premium at least once a year. Once you're enrolled in it, the price changes. And sometimes it changes once a year, sometimes it changes twice a year. One of the things that we take into consideration is when the last premium increase was and what the premium increase was when it increased. In years past, the average increase for a Medigap, every time, Medigap, average increase is usually between 4 and 7% each year. Because of the way the world works, from 2025 to 2026, that average went from 4 to 7% to 17 to 22%. There's a couple plans that raise their premiums over 30%. So that's one of the things we take into consideration. Sometimes it might not make sense to look at the lowest premium on the plan if the last time they increased their premium was 35%. Sometimes we maybe look at a plan that's a little bit more expensive, but their last premium increase was 10%. Because it's going to happen no matter what. Medicare Advantage plans, especially if it's a $0 premium, usually don't raise their rates. The reason that is, Medicare Advantage plans have a contract with Medicare that actually they'll start submitting soon for next year. So they submit, doesn't matter what company it is, they submit, this is what we intend our benefits to be for our members for 2027. And then Medicare looks at it and they say, yeah, this is great, run with it. Or they say, okay, this part's good, but you gotta lower the copay on the inpatient hospital stay, or you gotta increase the dental benefit or something. So they make a change. And then once Medicare approves that contract with the Medicare Advantage plan, it is locked in for the entire year and they cannot change it. Premium won't change, the benefits won't change for the whole calendar year. So like the Medicare Advantage plans that are available right now, those plans were approved in June of last year, and we knew October 1st what those plans were going to be, and they will not change for the rest of the year. So if I told you about a Medicare Advantage plan tomorrow, but you don't enroll into it until November, it's going to be the exact same thing. Will not change. All right.
Just real quick, I just want clarification for the Medicare Advantage. The difference between Medigap and the Medicare Advantage plus, say, a supplement like Wallaby, those are two different things altogether, is that correct?
Yes. So,
Just wanna make sure
yep. So have you been into the office?
Yes, sir.
Okay. Most people don't know about the hospital indemnity plans like Wallaby unless they've come and talked to us. So what she's talking about is difference between a Medigap and a Medicare Advantage plan is with a Medigap, once your deductible's met, all of your medical costs are covered after that, right? But with a Medicare Advantage plan, it's pay as you go. You'll have copays when you have services done. One of the most common and most expensive services that you'll have with a Medicare Advantage plan is an outpatient surgery, inpatient hospital stay, ambulance ride. Those things happen more common as we get more experienced in life. What she's talking about with a plan called Wallaby, and I bring that up just because she said it. So it's called a hospital indemnity plan. It basically reimburses you for the costs that you're responsible for with those services for way less money per month than if you had to pay it just out of your pocket. So we add those in actually with both now, because there's some things with Medigaps that are changing that it makes sense to have that hospital indemnity coverage or critical illness sometimes, especially with an Advantage plan. Cancer diagnosis, heart attack, that's going to dive well into your copays on an Advantage plan, but that critical illness policy is going to pay you a lump sum to fill in that cost that you're responsible for. So different, they work together. It's kind of like, I don't know if you can tell this, I like food. It's like you can have just a cheeseburger or you can put ketchup on the cheeseburger. The hospital indemnity plan is like the ketchup, right? The cheeseburger is good on its own, but the ketchup makes it a little better, or mustard, whatever your condiment of choice is. All right, so now we're going to jump into Social Security. Oh, one more, okay.
So when it's open season, can you switch from a Medicare Advantage plan to a Medigap or back and forth?
Excellent question. Can you switch from an Advantage plan to a Medigap? Kinda. Maybe. So with the initial enrollment period, we're going to come back over here. With the initial enrollment period, whether you're just turning 65 or you're leaving employer coverage and you're past 65, if you're new to Medicare, you have what's called a guaranteed issue period for a Medigap plan. So they don't do any medical underwriting. If you want to sign up for a Medigap plan when you first turn 65 and join Medicare, they just base the price on your age. With Medicare Advantage plans, they don't do any medical underwriting, so you can join that whenever your heart's content, as long as you're in an enrollment period. To go from a Medicare Advantage plan to a Medigap, outside of that guaranteed issue period, you have to do medical underwriting. So what they do is they look at your whole health history. They ask you a whole bunch of questions, and then they'll say, let's say, for instance, the Medigap was going to originally cost $170 a month. They'll look at your underwriting and they'll say, yeah, $170 sounds great. Come on in. Or they'll say, oh, looking at your health history, it's going to be $200 a month. Then you have the option to choose it or not. Or they're going to say, ugh, pump the brakes. We don't like what we saw in your health records. We don't want you. And they can just decline you. Yeah. So it's easy to go from a Medigap to a Medicare Advantage. Can be a little trickier to go from a Medicare Advantage to a Medigap. But it can be done. It's not totally impossible. Did you have something too?
Yeah, if you enroll in your 7th month,
Yes.
can you essentially wait? And that essentially means that you don't have to pay for the $202 for 3 months.
I see where you're going with this.
Yeah.
Technically, yes, because then this would, so say you enroll in Medicare in the 7th month, you've waited these other 6 months that you haven't paid it. So this year would save you $1,200, right? But yes, you can do that. Or, if that's a concern, you can look at the low-income subsidy. All right, moving on to the wonderful world of Social Security. Who here has heard of the three-legged stool? Somebody, if you've been to our office, you've definitely heard of the three-legged stool. So those 3 legs are Social Security, retirement savings, and employer-sponsored plans. Social Security, contrary to what you may have heard in whatever news channel of your choice, is not going anywhere, right? You're welcome, because what I'm paying into Social Security is what you're getting. That's how it works. I just hope people keep working so that I can get it. Retirement savings, that's your 401ks, your IRAs, 403bs, Roth IRAs, things you're responsible for. Employer-sponsored plans are pensions. Who here still has access to a pension? Way more than usual, I will tell you that. So congratulations to those of you that raised your hand. This leg is getting shorter and shorter and shorter for most people. Most people, I don't know what it's called if the stool only has 2 legs, but it's wobbly for sure, rely on Social Security and retirement savings. So we have to try to make this leg as wide as possible to make up for this one not being there. So that comes into timing. This is important, and it's a question that comes up a lot. You can enroll in Medicare and not collect Social Security. You can also collect Social Security and not enroll in Medicare. How's that possible? Easy. Your spouse is still working, or you're still working. And you don't need to enroll in Medicare because you have qualified employer-sponsored coverage. But you still want to take advantage of Social Security because does it make sense to collect it at 62? Does it make sense to wait until you're 67? Are we going to wait till 70? What timing is right? It's a good question. We're going to go over that in a minute. It might also make sense to sign up for Medicare and not collect Social Security for the same reason. Maybe you're working and you want to not be limited by what you can earn. Because who here knows what the limit is this year to work and collect Social Security without it being reduced? Anybody want to take a stab at it? There's no wrong answers.
23 or something?
Close, 24,480. You can collect Social Security and not have the benefit reduced if you're not 67 yet, and still earn 24,480. But if you don't want to have that limited, you don't have to collect Social Security, but it still makes sense to sign up for Medicare. It's basically everything I just said on this slide. So how do we know what's right? Well, you can log on to your socialsecurity.gov account and you can figure it out yourself. Or, like, I could change the oil in my car myself, but it's not going to be right, and I'm going to get real messy. Or you can have someone that knows what they're doing run you a Social Security timing report. We do it in our office and it doesn't cost you anything. And that will tell you, among other things, when a suggested time for you to collect Social Security is. Because it doesn't just take into account your Social Security, because that's not all the money that you have, right? You might have some savings. You might have some cans buried in the backyard. You might have an IRA. You might have a pension. You might have a 403B. We can show you in our focus visit what that combination of benefits looks like and when it makes sense to collect Social Security and then supplement it with the savings account that you have over here or an IRA that you have over here and make sure all that timing works in your best interest. The good news is that focus visit doesn't cost you anything but 60 minutes of your time and an open mind. And you'll leave with a written retirement income plan, a risk tolerance and portfolio comparison, and a tax reduction analysis. And here's what you can do with it. You can look at it and say, man, this is great. I never would have come up with this on my own. Let's do it. And then you'll get to talk to Kara for another hour. She'll work with you to get everything moved around. Or you can look at it and say, wow, this is a really great idea. I wouldn't have come up with this on my own. I'm going to do it myself. Or you can go tell us to jump in the lake. Either way, it still doesn't cost you anything, but some of your time and an open mind. That's it. Same with the health side. You can ask questions as much as you want. We are here for you. Our focus is education. We want to make sure that you are making the right choices to live the most outstanding retirement possible. Does that make sense? Social Security question time. I'm ready for you. Come on, somebody ask me a benefit about spousal benefits. Who wants to know about spousal benefits for Social Security? There we go. Social Security spousal benefits. So, couple different things. If you're still married, spousal benefits look like this. When the time comes and you start collecting Social Security, you get either all of your Social Security or half of your spouse's, whichever's bigger. That was pretty easy. What happens if you're not still married? You've been divorced. Well, there's a couple other caveats we have to look at. Have you been married at least 10 years? Is the divorced spouse collecting Social Security yet? Or at least old enough to? Same thing. You get half of theirs or all of yours. Pretty straightforward. Does that make sense? You get the bigger amount, right? So you could, yes?
So in that situation, if you're collecting your divorced spouse's Social Security, you can hold off on collecting your own?
What you can do is you can start collecting your own. Let's say they're not old enough to collect Social Security yet. You can start collecting your own and then switch to half of theirs if it's bigger. But if half of theirs is bigger, that's what you get.
Well, let's say you've been collecting half of theirs, and you want to wait till you're 67 to collect yours.
If it's bigger than theirs, then yes. Yep. You just get the bigger amount. Yeah. And again, you're welcome. You're welcome. We welcome you. You're welcome.
We get our share.
I got it. And the people that collected it loved it, right? It's not me. Don't thank me.
Go back and review that for me. So, both full-time employee, we then retire, we're within a year of each other, we then retire, we've paid in, we go to our Social Security, you go online, you look, and it shows you how much. We don't get what they're showing if we're still alive and living together and married. We don't get what they're showing for us independently total. They mesh it together somehow, so explain.
So the way that it works is that when when you both start collecting, whoever has the larger amount will get all of theirs, and then the spouse that has the not bigger amount, the lesser amount, will get half of the spouse's amount, if the half is bigger. If the half isn't bigger, they get theirs. The only reason you wouldn't get what you've put into is if your whole is bigger than half of the spouse's. Does that make sense? So here's an example. Your benefit is $4,000. Your benefit is $3,500. Half of your benefit, did I do that math right? 38? Well, half of 38 is, 16. 17. 19. None of us are on the financial team. All right, here we go. Let's say your benefit is $5,000 and your benefit is $6,000. Okay, your benefit's $6,000. Your benefit's $5,000. You're not going to get half of his because your whole is bigger than his half, right? That's how it works. You either get all of yours or half of your spouse's if their half is more than your whole. I don't want to tell you numbers because I'm terrible at head math, so I'm just going to tell you that. No.
But I think the confusion is, sorry.
Yeah.
It doesn't affect the amount that you will get.
Right. It doesn't affect your amount.
Your amount doesn't change. Your spouse could just get up to half of yours. Yours still being, say you get the $4,000, she can get half, she'll get 2, you still get 4.
Yes, it doesn't diminish your amount.
It diminishes
her amount.
If hers is less.
Yes. Correct. It doesn't change your amount. Same thing with the divorced spouse. So if you collect your divorced spouse's Social Security, they still get the amount that they're supposed to get. You just get half of whatever that amount is. It's not like they get half and you get half. So that's the fun part about Social Security, is it's not like what you've paid into Social Security is not set aside with your name on it. It's a running fund, right? So they just look at what the amount that you're supposed to get is, and that's what you get. Where it comes from, mystery box that Social Security manages, right? It's kind of like a big annuity, yeah. It's a trust.
So, and I didn't quite understand, are they both getting everything they put into Social Security?
No.
Why not?
Because that's how Social Security works.
Because they're married? So if they got divorced, would they then both get everything they put into?
No, it's the exact same. She would still get half of his if it's bigger than hers.
What if she killed him? I mean, he died.
Wait, let's not stop with the examples. No more ideas.
The good news is we can also assist with life insurance. That's part of the legacy planning process. How the person passes, I will leave to you, and whatever somebody was asking about confessions earlier. We'll talk about that later. You might need to step into the back.
Can you do me a favor? One more time, just sum that up. Say that, you don't have to give examples, no, but just sum it up.
So when you start collecting, whoever has the larger amount gets 100% of their amount. The other person gets half of that amount. It doesn't lower your amount. You still get, say you get $4,000, but $2,000 is more than her. It's the most that she would get. Let's say her benefit's $1,500. Because your $2,000 is bigger than her whole amount, she gets half of what your full amount is, but you still get the full amount.
So what if her amount is the same as mine, exactly?
Same.
She would get half.
So it's half.
her whole is equal to half of yours? So you both get 4,000. Then it's the same. You both get 4,000. So if you can manage to work enough and equally amount that your Social Security ends up being exactly the same, I think you get a special gold star. Because I don't know how that you would figure that out. But if the amount's the same, the amount's the same. But if her 100% amount is less than half of what your 100% amount is, she gets that half. So let's say your amount's 4, she gets 2,000, your total is 6,000. Not 4,000 because you get 2 and she gets 2. It's your 4, she gets 2 of the 4. Yeah. I need a dry erase board sometimes to map all this out.
Just tagging off of the conversation, say the one spouse retired, he's older, I'm younger. However, he would not be able to draw if I make the majority, I get bigger Social Security. Can his readjust if I say I retire at 62 and he's been retired for 5 years already?
It's individually based.
Oh, but me being his spouse though, because I'm going to retire after him about 8 years or so. But my Social Security is going to be higher than his, and
Right,
it's more
so
than
he
half.
would get, so say he starts drawing at 62. And you're not drawing yet. He gets his full amount. And then when you start drawing, if half of yours
Is more than
his, then he gets the half.
Does he could go right? So is it automatic or something we have to go back to Social Security with?
I think it's automatic. Do you know off the top of your head? I don't know off the top of my head.
But I have to be on Social Security.
You have to start collecting. Yeah. For him to get any of yours, you have to start collecting.
So that's kind of basically what I was going to ask, I think, is my husband's been retired for like 4 years, and I planned on working until 70, which is coming up. I'm making more than he did. So when I go to file for my Social Security and it's more, then he will get half, he'll get a raise.
Mazel tov. Yep.
So he'll be.
Sometimes it works out in your favor. There you go. There you go. Yes, sir.
You keep saying half, okay?
Yeah.
But my wife's getting less than half. I get about $3,600 a month. My wife gets $1,300. I'm still working, and we had to take it at 70.
Without looking at statement, I can't say for sure off the top of my head. There could be other factors involved in it.
Could it be, is Medicare Advantage being deducted out of it, so he's not seeing in the bottom line?
It could be the Medicare is reducing the amount.
We haven't never used Medicare. I'm still working and have insurance.
Oh,
Never used it. We had to get it Medicare at 65. We were told. We both signed up for it. Never used it.
So you have A and B now.
I don't have. I have A is what everybody.
You have A.
Yes, never used it.
Yeah, that's fine. I mean, that's okay. It doesn't.
I have B.
A, but you do not have B.
Do not have B. I have insurance through my employer.
Okay.
I'm 74.
I can't say off the top of my head without looking at statements. That's a little tougher. There's a number of factors that could play into that, so I can't say here. But the good news is that's a good transition.
Well, a good thing is we left it in because I was still working.
Yeah.
I didn't take it till we were forced to take Social Security at 70.
Yeah.
It was going up 8% a year. That was better than you could get on the market. So, you know.
Yeah, there are pluses and minuses for delaying collecting Social Security. That's part of what the analysis does, is it kind of makes sense. Because there's a gap in there. There's a redemption gap. Like, does it make sense to get it earlier? How long would it take to recoup the amount if you wait or if you don't wait? So that's all factored into the analysis on that. Without knowing for sure, though, there's a couple factors that could play into that. But we can definitely take a look at it and figure that out. It can always be adjusted. It can be adjusted if something's not right. Yeah. Okay, now we're moving on to the evaluation. Oh, yeah.
When you talk about the divorced spouse, is that only if you are not remarried?
Yes. If you get remarried, it doesn't count.
So I can't call my ex-husband and say I want money.
Unless you divorce the current one. No, you can't. No.
If you divorce the current one, can you collect off on both of them? Or all three?
I don't know off the top of my head. I have a book over here in my backpack that will tell me the answer to that, but I don't know. I don't know if you're familiar with the song. It's cheaper to keep her. That may be the direction, especially if she drove. That might be the direction you want to go, at least for tonight. Wait until you get home, because I can't protect you after you leave here. We can separate you two if we have to. Do you feel safe at home? Okay, all right. Do you feel safe? The answer to that is going to be determined. So now we're going to look at the form that some of you took notes on the back of. On there is our focus analysis, your first focus analysis, and how you rate yourself comfortability-wise in our 5 pillars of retirement success. Whether you're retired, still working, thinking about retirement, well into it. Again, just to review those pillars. F is future income planning. How do you feel about that? O, optimizing investments. Even if you're already working with somebody, I will tell you this because this happens a lot. You're already working with somebody, you're comfortable with where you're at with them. They helped get you to retirement, or they gave you advice to get you to feel comfortable about retirement. That's great. Sometimes the strategy to save the money, the accumulation strategy, gets you to where you're comfortable retiring. The strategy has to change when you enter what's called the distribution phase. Now you've saved all this money, you've put all your little acorns away. Now the winter of retirement is here, and instead of it being a finish line, now it's a starting block, because now we got to start spending that money and living the most outstanding retirement possible. Sometimes it doesn't hurt to have somebody take a look at it to make sure that your distribution strategy is what you need it to be. So even if you're already working with somebody, again, it doesn't cost you anything but time and an open mind. Tax strategies. Are you set up properly to not pay more taxes than you have to? Healthcare, that's a big thing. It changes every year. Important as you're filling that out, because I see some of you already have. There are no 7s allowed. There's no 7s allowed. Your grandkids would probably say there's no 6 7s allowed, but there's no 7s allowed. Your grandkids do that, don't they? She does. Yeah. 7s are like we don't want any I want definitives. 1 through 6, 8 through 10. No 7s. Strategic legacy planning. What is your plan? Is the plan to spend all that money before you're gone? I hope so. That'd be great, right? Leave them a bill, because nobody fights over a bill, right? Or is it to make sure that they don't have to fight over the bill because it's taken care of? We can help with all of those. Don't leave all your things up to just a handwritten note. That doesn't hold up in probate so well. A will and a trust can help with that. Yes, ma'am?
So when I signed up for my pension, they asked if I wanted to put my spouse on.
Yeah.
For 40, 50, 100% or whatever.
Yeah.
I explained it. Oh, well, it cost you like $4,000 a year. You know, they would take away from me.
Okay.
Which me and my husband could use now.
Sure.
And I said, well, if I die and some other take my money, why would I leave him any money?
So
and if he dies, then I'm out my $4,000 every year that I'm waiting for him to die.
right, so what she's talking about is with her pension, because she has a pension. Good for you. Depending, I'm going to say it a little bit differently just because I have a microphone on and you don't. So you are asking about how you set up a pension for spousal benefits. Some people decide to collect 100% of their pension for that same situation where she doesn't want some other lady to take advantage of, you didn't say it that way, I know, but some other lady to spend your money, right? You're gone, it doesn't matter anyway, but I understand where you're at. So what she did is it's a 60-40 maybe, or didn't give him anything. So one of the options was there could be spousal, so like she gets a certain percentage of her pension now, and then if she departs her mortal coil, he would get a smaller portion of that pension. You can set it up that way, or you can just take what you want. Take it all now.
See, and knowing now, what I know now, if I would have known when he retired and he filled out the paper, he left me some of his pension.
Aw,
I know.
good for him.
But we could use the money now.
Sure.
I have my own pension.
Yeah.
I wish I would have known that when he filled out the paper, because we could be spending the money together now.
We have a lovely,
No.
not usually, no, because the way that most pensions are set up, it's basically an annuity, and once you start taking from that, it only comes out the way you set it up, and you can't change it. Yeah. Most people don't have to worry about that because they don't have pensions. So it's not usually an issue for people. All right, so no sevens. Rate your thing. The importance of this form, I will tell you this. The importance of this form is so that we can track that you came to the event. We're not going to bombard you with emails and phone calls and all that stuff. But the advantage of that is that we just have to keep track of it for tax purposes to prove that we had the event, prove that people came here and I didn't just make up all these people. And we also want to know where you're at because it helps us refine what we talked about tonight for the next group because you guys were great. Awesome questions, outstanding interaction. You all get gold stars. But this helps us refine the information that we need to bring up for next time. Because anytime you ask a question, that means I didn't go over it in advance. So this is good. We do have to collect those from you. Now here's the next step. What do we do now, right? What is the payoff for you putting yourself first and coming out to learn about this tonight? The next step is we would love to visit with you in our office in Freeland. Or we can do it over the phone if you don't want to drive to Freeland. But the weather's getting nicer, and we're right across the street from Riverside, so you can come see us and then go get pie.
The other side.
Or the other side if you want to go get a cocktail, which is live your life. Do whatever you want. So Kara and Olivia's going to put down the microphone, and Kara will, if you would like to schedule time to visit with us, whether it's for health questions, financial questions, trust questions, questions about the cookies that we have in the office that are fresh baked by Mindy's daughter, Ava. I look like this because she keeps bringing them into the office. And they're really good. They will be more than happy to get you scheduled. There's no commitment to anything. If you come and visit with us, it doesn't mean you're signing up for anything. It doesn't mean you're moving anything. None of that. It just means we're going to answer your questions one-on-one because sometimes your question you maybe don't want to ask in front of a bunch of strangers, and I get that. But it's nice to, if you have a little bit more advanced question, we can sit down and go over it in person. So that's where we're at.
Do you help us sign up for this stuff or just?
Yes, so good question. So what happens after the visit? Let's say you come in and visit with us and you're ready to enroll in something like Medicare. We can show you step-by-step how to enroll in Medicare. We can help you enroll in Medicare. That is done with Social Security, but we can show you how to do it. We can also help with it if you need it. But then if you pick out a plan, we're more than happy to help you. And the nice thing about that is when you enroll with us, again, it doesn't cost you anything. We don't charge you anything to enroll you, right? So what happens is you become our client. And then if you have questions, you can call us, and we have access to certain things on your account that we can help you. Not that there are ever issues, but if there is, we can help with that.
You asked what county everybody was in. Does the cost go by according to counties or something?
Cost doesn't change by county. Availability changes by county. So specifically with the Medicare Advantage plans, and to some extent the Medigap plans, but mostly Medicare Advantage plans, certain plans are available in certain counties. A lot of plans are available in most of the counties in the state, but what plans are available, and to some extent some of the cost of the plans does vary from county to county. Yeah. I'm going to come to you second. The one that questioned her husband's choices in the back first.
So when you mentioned about signing up, when I was getting close to having to sign up, it was so confusing listening to the TV, all the stuff that comes in your mail, all the phone calls that call.
Yeah.
I was so confused. So I came to talk to Mindy's.
Yeah.
And my doctors, my prescriptions, everything, I went in, they gave me brownies, I was with linens and the silverware, got some cappuccino.
Yeah.
And they set everything up, I just had to listen.
Yeah.
So my husband, the same thing, I sent him there, they set him up. When Blue Care, I'll call it Blue Care, something or other, network.
Blue Cross, Blue Care Network,
yeah. He had that, Blue Cross.
Yep.
And first he had Covenant.
Yep.
And they contacted him right away and said, that's going away. It's not going to be in Michigan or something anymore.
Yeah.
So they switched him to Blue Care.
And then that one went away.
Then they called him up and say,
Yeah.
the next year.
Yeah.
And then they just automatically set him up and took care of him.
Yes.
And so anybody that I talk to, I say, go there. Because you don't have to do anything.
I have no idea who this woman is. It sounds like it was a plant. I never met her in my life. No. So And so what she's saying is exactly what we do. So there are changes that happen every year to your options. And you're more than welcome to figure out what those changes are and figure it out yourself. But we go through extension. I was in a webinar yesterday, 2 webinars yesterday, 1 today, we got 1 tomorrow. We are constantly being re-educated on changes to what's coming, changes to what's available, to make sure that we can easily explain it to you so that you know what the best choice is, right? We guide you down that path, and then we do the paperwork for you. Because who likes to fill things out online? No? No one? Me and Kara. That's it. Most of the things have to be done online. So you can either do it yourself or we can do it for you, which again, does not cost you anything for us to do it for you. We just make it easy. And then when things do change, because sometimes plans go away, we let you know in advance so that you can plan for those changes. Because it's a big change going from a health insurance that you've had for a whole year to all of a sudden it being gone by no fault of your own, just the health plan went out of business or whatever, because that happens sometimes. We make sure that you're aware of that, and we review the plans that are available so that it still fits your needs. And she's spot on. We look at your doctors, we look at your prescriptions. Like again, 27 plans in Midland County, all of them cover medications differently. So then we have to look at what's the most important feature for you. Are you most concerned about dental coverage? All right, we'll look at a plan that has a rich dental plan. Are you more concerned about making sure your Ozempic is covered? Great, that kind of guides us in one direction because we know what plans cover Ozempic better than others. Do you need to see a specialist at Henry Ford? Perfect, we'll find you a plan that's going to work both here locally and at Henry Ford. All those factors go into play to point out what the best recommendation is for you.
What's your name? I didn't catch your name at the very beginning, I apologize.
My first name is Nick, like the saint. Cain, like Abel.
Got it, thank you.
Yeah. That wasn't the right, it was the wrong brother, but that's how it's spelled, C-A-I-N. I have cards up here too. Yes.
So some of the plans are geographical. What happens if you travel?
Excellent question. So if you travel with a Medicare Advantage plan, actually any health insurance plan, whether it's Medicare or not, it is a Healthcare Reform Act requirement that every single health insurance plan covers you for emergencies and urgent care no matter where you are in the country.
That's for the Advantage plan.
Any insurance. Your employer insurance, if you get it through the marketplace, if you get it from your job, if you get Medicare, if you have a Medigap plan, just regular Medicare, has to cover you for emergencies and urgent care the same way as if you're in network. There are certain Medicare Advantage plans that do work outside of Michigan. And if that's, say you snowbird and you spend 3 months in Arizona, we'll make sure that that gets factored into what plan we recommend for you so that while you're there, there's no gap in coverage or issues or anything. You can still use your coverage the same way there as you can here.
So what are the drawbacks to an Advantage plan?
That's a good question. Depends on your situation. If this is, I think we still have time for this. So there are 4 main reasons why we would say don't do an Advantage plan, do a Medigap plan. And this is, again, case by case, but in general, if you're actively undergoing cancer treatment, you're getting monthly infusions that cost several $1,000s a month, you have to go to the Mayo Clinic, or you're in a nursing home. Then we would say, let's look at a Medigap plan instead of a Medicare Advantage plan. Because Medicare Advantage plans have something called a maximum out-of-pocket. It's very similar to how the maximum out-of-pocket works with your employer coverage. That's the most you would pay for medical care for that year. Usually they're around $5,000 or $6,000, and most of the time, only about 5% of people ever get to them. And usually they only do it twice, because they either get better or they no longer need health care. With a Medigap, those 4 situations, you're going to get to your maximum out-of-pocket, and sometimes you're going to have to see people that are out of network or that might cost more. Then it makes sense to do a Medigap. So sometimes a network, most of the time not, but sometimes a network can come into play. There's HMOs, health maintenance organizations, there's PPOs, preferred provider organizations. Easy way to remember the difference. HMO, only in network. PPO, in network and out of network. this is the way I look at it. If most of your doctors are around where you live, you can't spell home without HMO. So an HMO is a great option. But sometimes a PPO makes sense too. So again, case by case. So we look at all those. Yeah. Okay. Here's where we're at. Kara is going to stand over there. Olivia is going to come stand over here. And I'll still be available for questions. But if you would like to schedule a visit, again, does not commit you to anything. They will be more than happy to get you scheduled. Doesn't matter what the visit's for. Can be for any of the areas of our focus process. We'll be more than happy to visit with you. We don't always have brownies, but a lot of times we do. I will say that Mindy's mom just brought in raspberry cheesecake, and it was really good. It was really good. Olivia had 2 pieces in one day. I hate to put your business out there like that, but she was eating a piece, and then a couple hours later I came by and she was eating, I thought the same piece. It was not. It was a different piece. But it's that good. So there's rotating snacks in the office all the time. We always have fresh coffee. We always have chocolate chip cookies. There are chocolate chip cookies all the time. They're always warm. Yes, sir.
Question, if you're doing all these things free and all these things, how do you guys make money?
Great question. How do we get paid? That comes up a lot. So on the health side, we get compensated by the insurance company as long as you're a member. As long as you enroll with us and you're a member with that insurance company, we get compensated for that. And I will tell you this because it eventually will come up. That means that you probably recommend one plan over another because you get paid more for it. That is not true. So with Medicare, there is a contractual limit to what Medicare Advantage plans can compensate agents. And it's standardized by Medicare, and no one pays less than that usually, so there's no bias. We just recommend what's best for you. Same thing with Medigap plans. It's regulated what they can pay us. On the financial side, it depends on what kind of investment vehicle you work with. Sometimes there's a fee, sometimes there's a flat cost. That's all discussed on the financial side. I sit next to them, but I never know what they're talking about. So that's how we get paid. We get paid from the insurance companies.
In the fall, we get deluged with all kinds of information trying to get us to go pick somebody's plan.
Yeah.
And everybody I've talked to, nobody seems happy with any of the plans.
Oh, talking to the wrong people.
Yeah, you need some new people in your life.
So what we do for you, you can do on your own. Does it mean that you're going to know what you're looking at? Unless you, I'm a licensed insurance agent. I go through continuous education on a regular basis. Unless you do that, you might enroll yourself in something that's not right for you. And that can happen, and it happens all the time. We see it every day. That's why we recommend you work with an agent that can help avoid that. Because there's certain things that we know to look out for you that you might not find on your own. And sometimes you find out about it and it's too late, you can't change it. But that happens a lot. But we're always happy to review coverage and see where you're at. That is all I have for you. On the bottom, if you could just indicate if you want to schedule a visit, we can do it now. If you don't want to, just leave your evaluation where it's at and we will collect it from you. I appreciate you all coming. We do have a book up here. It's all about the holistic retirement, which is kind of the way we go about doing things. We look at the entire picture of your needs and assess our advice based on that. This is free. Mindy wrote the foreword of it. Please take 1 or 2 if you'd like. If you have a friend and want to have a book club, this is a great book club option. Thank you all for coming.